So it's pretty obvious, I think, to most people who read the newspaper, and certainly to clinicians and to government officials, that we're in the middle of a pain crisis in the United States, and frankly, I think throughout the world. We don't have a lot of the education, training, experience on how to treat people who have chronic pain. And we're relying very heavily on opioids as our main tool, and it's becoming increasingly clear that that's not the right tool. They have a place in certain times and situations, but it's clearly not as universally applicable as it's being used right now. So, for instance, we're discovering that opioids are a big source of addiction, overdose, death. It's now the #1 cause of accidental death in America. And in addition to that, there's more and more science that's telling us, even apart from addiction, even unrelated to addiction, that opioids make pain worse. And that we're not doing our patients that have chronic pain any favors by treating them with a medication that actually has almost a neuroinflammatory component to it. And so more and more it's becoming clear that we have to come up with other tools, other approaches, more understanding. We have to get clinicians of all kinds more interested in this. They have to work together as teams, and we are very clear, and I think frankly everybody is, that the education is not out there. And so we see a big need to do this, not just for doctors, but for the nurses, for the physical therapists, for the occupational therapists, for the psychologists, for the social workers, for the dentists, for all the people who work with patients, often patients in pain, and can contribute, need to understand the problems, can certainly be parts of teams. These are the folks that we want to get more education and training to.